As the CEO of CogentHMG, I'm both privileged and honored to work within a company that I passionately believe is poised to do incredible things in the healthcare system. I'm honored to work with this team of highly respected physician leaders who are directing the charge. At CogentHMG, we see the uncertainty in today's healthcare landscape as a remarkable opportunity to do more than simply improve, but to truly transform the way that healthcare is delivered in a hospital setting. Leadership is at the core of our being at CogentHMG. Our leadership approach is based on 6 key principles, ideas that will be the key to revolutionizing hospital medicine.
The human side of medicine is getting lost. As physicians, we are highly trained individuals that came into this field to deliver great care to our patients. But with the complexity of the healthcare environment these days, we're focusing on efficiency, on communication, on technology, and all of these areas pull us away from the bedside.
We cannot let complexity overshadow compassion. We have to shift the focus back to patients and their loved ones. We have to understand and respect that a hospitalized patient's entire day revolves around the visit from the doctor. So we have to make it count.
This is what CogentHMG is about. This is our mission and this is our vision.
We're looking for great physician leaders at CogentHMG. Colin Powell said that great leaders are almost always great simplifiers who can cut through argument, doubt, and debate to provide a solution that everyone can understand. Those are very profound words. What we're trying to do at the end of the day in the hospital for patients, which is why we're all here, is to make the right decision at the right time. One of the characteristics that we look for in our leaders is they have the simplicity of purpose, the straightforward approach that allows them to cut through all the complexity of the hospital to deliver clear messages to the physician team that they're leading.
That clarity leads to truly patient-centered care. For example, using unit-based rounding to cut down on the time a hospitalist spends crisscrossing the hospital campus to see patients, carving out more time to actually see patients. Simplicity is good for everyone.
As leaders, we never stop learning, and fitting in is not our goal. For us, it's not enough to know how a hospitalist program can simply peacefully exist within an established hospital structure. We must define new expectations and processes. We have to learn from the way things have always been done. We have to learn from the past and constantly use that knowledge to create new, better ways of doing things.
We learn together from all members of the team. Through peer leadership, we build hospitalist teams that are not focused on marching toward a prescribed vision of success. Instead, we are evolving toward our highest purpose through the collective learning experiences of everyone on the team.
Culture is king. This is one of the most important and least tangible elements in hospital medicine. A culture that fosters growth, improvement, and evolution. And teams need true leadership without ego, in a culture where team players are recognized as heroes. Patients first. Within the successful CogentHMG culture, the patient comes first, not seniority or hierarchy or rivalries or scheduling conflicts. There is no prescription for a culture of evolution. In many ways, it's a naturally occurring phenomenon. But through our years of industry experience, we know how to find and retain the right leaders. We place them with the right teams, and we nurture a culture of constant collaboration toward patient and physician satisfaction.
The historic relationship between hospitals and the physicians that work in hospitals, in my opinion, has interfered with good patient care in the past. And that's because many times physicians in hospitals function more like adversaries than partners. We aim to change that, and we're looking for the physician leaders in our company to help us do that.
A shared vision, that comes from solid leadership. And when we put strong leaders in place, the physician and the hospital, well, they share a vision. And they share accountabilities, and they'll share stewardship of resources. And when that's accomplished, well, they share the rewards, they share the incentives. The physician and the hospital can create a true partnership when it's based on mutual respect, respecting one another's professions and one another's point of view. And leadership, well, that unlocks the potential of that partnership. And frankly, it unlocks the potential of hospital medicine. Hospital medicine as a profession presents the ideal opportunity to bring the hospital's best interests together with the best interests of physicians and patients.
Negativity from a leader can destroy a team, but optimism is a force multiplier. When we create teams that are based on optimism, encouragement, and maximizing potential, that attracts other people into that team and allows us to accomplish things that could not be accomplished otherwise.
The only way to ensure success in this dynamic healthcare environment is to have personal conviction that it can truly be done. At CogentHMG, we do. And under the guidance of our forward-thinking industry leaders, we've set out to change the way inpatient care is delivered, and we're doing just that every day. Our fast-growing organization has room for like-minded leaders who truly believe that reacting to change is one thing, but defining that change will move the industry forward.